So how to complete the complete upper limb in 7 days? So first of all, we will tell about all the things you can complete in 7 days. Okay, first of all, you have to read bones, artery, nerves, vessel, the general concept of bone, artery, nerve, and vessel. Okay, about the upper limb. After that, you have to start the regional anatomy. In regional anatomy, you have to study first of all the shoulder region. Okay, after that, you have to read the post. In first day, you have to read this bone, artery, nerves. In second day, you have to read the shoulder region. All things about the shoulder region. Okay, in the third day, you have to read the posterior scapular region. Okay, quadrangular space, triangular space, all of them. Okay, in the fourth day you have to read the axilla, and in fifth you have to read the arm, and in sixth you have to read the forearm, and the seventh day you have to read the hand. So in this way you complete the upper limb. You have to complete your upper limb. Okay, so in this video we will tell about complete upper limb. Okay, that how we will tell you the complete upper limb regional anatomy, how to complete upper limb. Okay, so complete upper limb. So first of all, first is the you have to cover all the bones. Okay, bones. Just I have already created a video on the bones and artery, muscle, and nerves. Yeah, one hour video. Okay, just like what you have to first of all watch that video. Okay, that you just like a sketch of the bones, artery, muscle, and nerve. After that, you have to start the regional anatomy. Regional anatomy. First of all, you have to read the shoulder region. Shoulder region. Okay, when you read the shoulder region, after that the shoulder region, you have to read the posterior scapular region. Posterior scapular region. Okay, and after that, when you read the posterior scapular region, you have to read the axillary region. Okay, all of the thing. After that, you have to read the arm region, and after that, you have to read the forearm region, and after that, you have to read the hand. So these all are the things that you have to need. Okay, now we will go through each of them. Okay, one by one. Okay, what is shoulder region? And after that, we have to create. You can watch each video on these regions. Okay, if you complete all the these region, you have to complete the upper limb just like this. Okay, now we will move through each the topic, and when we created the regional course, that first of all we cover this, then just like this. Okay, so you have to know all the things about the upper limb. So first of all, just come here to regional region. Shoulder region is there is a bone. Okay, what bones? Clavicle and scapula. These are two bones in the shoulder region, and they created the pectoral girdle and shoulder girdle. Okay, another is the proximal end of the humerus. For example, this is the humerus bone. So the proximal end of the humerus is also contained in the shoulder region. Okay. So another is the joint. There are many joints. We will discuss the glenohumeral joint in the glenohumeral joint. Okay, and after that we will discuss the muscle of the shoulder region. So these are the shoulder region. After that you have to go to posterior scapular region. Okay, so in posterior scapular region, all about the muscles, the gateway of superior scapular region. So what are the gateway of the superior scapular region? So the gateway of superior scapular, gateway of the posterior scapular region are the first gateway is actually the gates. Okay, where the nerves, artery are move on. Okay, so the first is the subscapular foramen, another is the quadrangular space, triangular space, and triangular interval. So you have to understand these all things. Okay, without for I have complete mind map. If you have missed anything in these all things, you don't know complete upper limb. Okay, the next region is the axillary region. Okay, so axillary region have four sides. One is anterior wall, another is medial wall, lateral wall, posterior wall. Posterior wall have muscles. Okay, and gateways. Okay, we will discuss it. They are muscle, all of the muscle, and in posterior wall there is a gateway. We will explain it. Okay, and axilla has inlet and floor. And another is the content of axilla. Content of axilla is biceps brachii, coracobrachialis. Okay, another thing is the axillary artery, axillary vein, brachial plexus, and lymphatic. Axillary artery have different branches, three branches. We will explain it in the axilla. Okay, another is the arm have humerus shaft and distal end. So you have to discuss the humerus shaft and their distal end, what the ridges and all the things condyle are present in the distal end. Another is the muscle of the arm. One is the anterior, another is the posterior. Anterior is actually flexor muscle. Okay, and posterior is actually extensor muscle that extend the arm. Okay, after arm have also artery and vein. Vein are paired brachial vein. Actually, vein are paired brachial vein, and another is the brachial artery. Okay, what brachial artery is also present in the arm. Now the next thing is the nerve. Nerve are musculocutaneous nerve, median nerve, ulnar nerve, radial nerve. Mean these all nerves are present in the arm. Okay, and only musculocutaneous nerve supply to the bicep, to the anterior compartment of the arm. Okay, and radial nerve supply to the posterior compartment of the arm. Now it is arm, and elbow joint is also present in the arm region. Okay, and cubital fossa is also present. So you have to know about the cubital fossa boundaries. That what is the boundary of cubital fossa and what is the content of cubital fossa. This is very important MCQs and questions for the exam. Okay, another is the E is the forearm. That forearm is also the region. Okay, so between the elbow and wrist joint is between them is the forearm region. Now first of all is bone, radius, ulna. Bone are radius and ulna. Okay, joint of the forearm are distal, radio, ulnar joint. Okay, now the muscle are anterior compartment of the forearm are, one is the superficial muscle, another is intermediate layer, and another is the deep layer. So superficial muscle are flexor carpi ulnaris and palmaris longus. Okay, and flexor carpi radialis and pronator teres. These are the superficial muscle. Means four superficial muscle are present in the forearm. Intermediate layer of flexor digitorum superficialis are the intermediate layer, and the deep layer of flexor digitorum profundus, flexor pollicis longus, pronator quadratus. These are the deep layer. Okay, in anterior compartment. Now arteries, the anterior side, if you see the arteries, so the artery are radial artery and ulnar artery. Nerve are median nerve and ulnar nerve actually present in the anterior side. Radial nerve is also present anterior, but it divide into two, superficial and deep, and then deep move toward the posterior side. Now posterior compartment muscle are the, one is the superficial, another is the deep layer. Superficial muscle are the brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum. Okay, extensor digiti minimi, extensor carpi ulnaris. 1, 2, 3, 4, 5, 6, and anconeus. This is the third muscle. So these all have 7 muscle. Okay, now at the deep layer, if you see the deep layer have supinator muscle, abductor pollicis longus muscle, extensor pollicis brevis, extensor pollicis longus, extensor indicis. These are the deep layer. These are the muscle of the deep layer. 5 muscle are present in the deep layer. 5 muscle are present in the deep layer, 7 present in the superficial layer. Now in posterior compartment there is also artery and vein. Artery are, one is the posterior introitious artery, and posterior introitious also give recurrent introitious artery. Okay, also contribute to recurrent introitious artery. Another is the radial artery. Radial artery is the one is the muscular branch, another is the two extensor muscular branch. Radial artery have muscular branches to extensor muscle. Okay, and to which extensor muscle? That is near to the side of radius. Okay, that is nearer to the radius. Another is the artery of the posterior compartment. Artery are radial nerve, lateral wall. One is the lateral wall of the cubital fossa. Radial nerve has lateral wall. That is a radial nerve is actually present to the lateral side of the cubital fossa, and it give posterior introitious nerve. Okay, the deep radial nerve are the deep branch of radial nerve goes and form posterior introitious nerve. Now this is about the arm. Now forearm. Okay, now about the hand. Hand have one wrist, metacarpal, phalanges, 3 things. So the wrist have 8 carpal bones. And how can you remember? One is the first row and another is the second row. So first row you can remember that she look too pretty. So SLTP. So you have to remember this sentence. She looks too pretty. So S means scaphoid bone, L means lunate, T means triquetrum, and P means pisiform. Okay, scaphoid, lunate, triquetrum, pisiform. These are the 4 bones. Now the 4 other bones are one is the trapezoid. So how can you remember that? She looks too pretty. Try to catch her. So just like you have to remember this sentence, and from this sentence TTCH. So T means trapezoid, trapezium, trapezoid, capitate, hamate. These are the 8 bones of the carpal. Now there are 5 metacarpal and 14 phalanges. Okay, the joint are, one is the rest joint, carpal joint, carpo-metacarpal joint. That is mean that between the carpal and metacarpal. Another is the metacarpo-phalangeal joint between metacarpal and phalangeal. Another is the interphalangeal joint between the phalanges. Okay, there are many other things. Carpal tunnel in the hand, palmar aponeurosis, anatomical snub box. This is very important, anatomical snub box. Okay, this created from 3 muscles. Another is the extensor hood and fibrous sheath. Now muscle of the hand are intrinsic muscle of the hand. Intrinsic mean that these muscles are present in the arm, and extensor mean that the muscle come from the arm or from the forearm, and they move toward the hand. In the hand there must be their tendon etc present. Okay, so muscle of the hand are palmaris brevis, okay, dorsal introiti and palmar introiti. Another is the lumbrical. Okay, and another is the adductor pollicis. Now there are also thinner muscle in the hand and hypothinner. Thinner, for example, this is your hand. We will explain this in detail when we explain all the region. Okay, so there are, this is your palm. So there are the thinner muscle, and here are the here are the hypothenar. So theer muscle is opponent's pollicis, abductor pollicis brace, flexor pollicis brace. These are the three muscle of the theer. So hypothenar है. So first is the opponent's digiti minimi, abductor digiti minimi, flexor digiti minimi, brace. These are the hypothenar. This is the thenar muscle and this is the hypothenar muscle. Now come here to the artery and vein. Artery are, one is the radial artery, another is the ulnar artery. Radial, when the radial artery come along the radial side and they form the deep palmar arch like this, deep palmar arch, and the ulnar artery, when the ulnar artery come here, they form the superficial palmar arch. So you have to remember that radial artery form deep palmar arch, ulnar artery form superficial palmar arch. Now dorsal venous network on the back of the hand. There are, if you ask about the veins, so there are the dorsal network on the back of the hand. Now about the nerves, one is the ulnar nerve, another is the median nerve. So most of the muscle are supplied by most muscle supplied by the ulnar nerve and some of them are supplied by the median nerve. So this is about the complete upper limb overview, and after that, so we will create a video that you have to watch one by one things, okay, and the complete upper limb is explained like, so comment your idea, everything, okay, we will explain it, okay, one by one, auxiliary shoulder region, auxiliary region. So subscribe the video and thanks for watching.